All right, everyone. This is the first video of this kind that I have ever made, so let's hope it goes well. I want to talk about dental issues. Dental issues in rabbits, as we all know, it's all too common. And if it's caught early, generally it can be fixed and not be terribly expensive. But if it isn't caught early, it can be thousands and thousands of dollars, and or you still have to put your rabbit down. And I hate to say it so bluntly, but I'm choosing to speak about this subject because I spent a year and a half absolutely immersed in it with two rabbits that died, one in the middle of my floor and the other that I had her put to sleep. It was the best thing to do, and I should have done it earlier. Um, some of this is a cautionary tale because it's what happens when you think you know or you don't know there's a question to be asked. And then you get bad information. Anyway, dental issues. I'm going to start with just a list of things that you can look for. Um, that if you see these things, it's not going to, all of them aren't going to necessarily mean yes, it's a dental issue. But if you see these things, dental should be one of the things that comes to your mind. So, one of the first things, and this is in no particular order, if they have small fecal pellets, if their poo is small, and I think probably everybody knows this, but I'm going to talk as though you don't know anything so that the people who don't know can learn. If they have small poo, it means, of course, less intake, less coming out. Um, if they're irritable, and you're in pain and you feel irritable and they're less active, if you hear them grinding their teeth. I think we all know grinding teeth really loud means pain. If you hear them grinding their teeth, they're in some kind of severe pain. If you see any kind of drooling, if their chin is wet, if their chest is wet, if they paw at their mouth at all, or if you can tell that their jaw is swollen. And something you can do, it just as say when you're grooming them or filling them, for lumps and things. If you feel their jaw, and of course you can feel the jawbone. If you feel around the jaw, I got to where I could spot an abscess before even knew that it was going to grow there. And you'll be able to feel like a lump, like a small lump starting, or hopefully not a large one. But you can feel their jaw for abscesses. And of course, like I said a second ago, if the jaw looks swollen, if their front teeth are uneven, that's a sign of dental issues. If they have bad breath, that's a sign. If they have matted fur, say around their rear end, their chin area, that's because they're low energy and they're in pain, and so they're not grooming like they normally would. If you notice they're losing weight or they're picky, like being a picky eater, say they're in the middle of eating and they drop food while they're eating, that's a sign. Um, Low energy, I went over that. A big sign is runny eyes. Now, runny eyes, I know can be a handful of things, but what happens with the teeth is that the roots block the tear ducts. I'm going to attach to this a picture with an abscess and a picture just of like a diagram of a rabbit's head that probably everyone has seen. And you'll be able to understand what I'm saying, how the roots can block the tear ducts. It literally looks like they're up under the eye socket, and it causes the eyes to discharge. So any of those signs warrant thinking to yourself, possible dental issues. Um, this is something that you can catch early. I guess if you're aware enough or lucky enough. The cheek teeth, they can overgrow and get spurs. And this, again, on the diagram, it'll show you what the cheek teeth are. And those spurs cause ulcers, and then they end up with an abscess. And of course, from there, they're in pain, they're not eating as much, and then we're in stasis, and that's basically how the story goes. Now, so I spent a year and a half with this around the clock. Unbelievable, horrible surgeries. No living thing should ever have to go through that. I mean, nothing should ever have to live through that. So if you look at the diagrams and the pictures that I'm putting up, I have very few pictures. This is B and Albert. B is the one with the big ears. Albert is the one that just looks like a big snowball. Both of them died from severe dental issues. One, because I guess they have a name for it now. But when I was going through this, they didn't. They don't know why, but a lot of domestic rabbits are born with their jaws out of line. And so her jaw was out of line. And the other rabbit, Albert, I found out long after the fact that the people I got him from, they had young children. And rabbits are not good pets for kids. I'm just going to throw that out there. I don't care what they say. Rabbit is not a kid's pet. And the kids would chase him and pick him up and play with him, and they dropped him. And his jaw had been broken. And I can't even imagine what it was like for him, but somehow it healed and he managed to eat, and nobody knew it until everything was really, really bad and I rushed him to the vet. So that's what caused his. If you have any questions, please leave them in the comments. If you have anything to add, please leave it in the comments. My apologies. This isn't usually the kind of video that I make, but this is really, 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 really important. And my information comes from basically living at my vet's office for a year and a half, doing research and living through it day by day. And one of the pictures that I'm putting up is kind of brutal. The one of B where she looks just really, really, you'll be able to spot it. That was just after, it was the surgery she had just before one of her teeth tried to push her eye out of the socket. And so then that was another surgery. But you can see she just looks horrible. And it was a surgery every single week. And it was just horrible. And so, but this is not about them. It's about what happened, and I don't want it to happen to anyone else. So maybe I will list the symptoms in the description instead of me just kind of randomly rattling them off. I'll list them so you can read them, or write them down as a checkpoint or whatever you want to do. But in any case, thank you so much for listening, and I hope this helps in some way. I really, really do. And I'm so sorry that it's not like all the super professional videos that everybody does, 10 reasons why your rabbit loves you with, I don't know how to make those. Those just aren't what I make, but this is very important. So any questions, anything to add, please put it in the comments. And thank you so much for listening. And I hope this helps anybody. Thank you. Okay, I need to add just two things on here that I forgot to mention in the body of the video. The pictures, the first two pictures that you'll see will be of B and Albert when they were healthy and their eyes looked normal. The rest of the pictures, like I said, I have very few pictures. So I've taken them and I've tried to blow them up where you can see them better. But if you look close, you will see how bad the matting and so forth was around the eyes. On Albert, it was so bad that he had almost no fur even on his nose. You'll be able to see it and tell. And the other information that I wanted to add and didn't think of in the moment is that also it's important to know that when the teeth overgrow, I did mention this about B, but they can grow into the eye socket and literally into the eye or push the eye out. And another thing that is really important that is not something that you can see or feel is their teeth can literally grow to where it blocks their throat. And so that that's when they do just a regular exam, they don't even need x-rays, I don't think, to see that. But it's very important that whoever doesn't know that you know that the teeth can grow where they basically, even if they could eat, it'll trap their tongue. It's brutal. So very important information there that I missed. Thank you for listening.